young man who, yeah, I'm saying a young man because he's a young man. He keeps telling me I'm a young man. And while the mother was asking me, your boss, is he fasting or that's how he is? So, the brand doesn't change you. Whether he eats junk or not, he's the same person he is. You know, he's been on a lot of global platforms, very passionate advocate on non-communicable diseases. You know, typical of a Ghanaian, he doesn't joke with his work. Yeah, he's very passionate, very passionate. Those of you who know him or have experienced him, or better say, those of you who have worked with him, you know, maybe hand in hand or face to face, you will guess what I'm talking about. And he's going to share with us some reflections from CSO perspective on the declarations and key priority areas for Ghana. So, Abraham Musa, let's have you to briefly, let me emphasize on that word, briefly share with us on CSO's perspective on these global declarations and the way forward. Thank you very much.
Can I have a presentation? Yes, so thank you very much, everyone, for those kind words. Well, I am not sure where we got those incidents from. Yeah, but indeed, I always try to ensure that my staff are healthy in the office. So I try to not to remind them, but call them to ensure that at least at every point in time they are fit enough to continue their work. Of course, if you have staff who will always say, I'm sick, sometimes as a manager, you definitely will not be happy, so you want to encourage them to continue to be fit. And that's why we have dedicated everything for this activity in our office. Don't be surprised if you see us in our outfit like this, training after this meeting here, because we pitch camp anywhere to ourselves, just so we don't miss our Thursday physical activity from 4 to 5 or 5:30 every Thursday. Right, so I have a task, and I'm happy that we've heard from the global NCDs, the perspective they shared, and indeed, we have been part and parcel of their process. So it's important that we also share civil society in Ghana perspective as far as matters of communication are concerned. But before I proceed, let me acknowledge the presence of the minister's representative now this year, Dr. Alhaj Hafiz Adams, and our base. We deeply appreciate your presence and also the CEO for mental authority. And I also have my own friends. Sometimes we don't meet, but Dr. Bepe, your presence also acknowledged. And then, of course, I also acknowledge many new faces I've seen here, and also the old faces I've seen for a while. You are all welcome to this important event. I know at the end of the program we'll duly thank everyone. Right, so I'm looking at the series of reflections on the outcome of the UN High Level meeting. So you're looking at Ghana specific, but I'm looking at also globally, just as this can be. But just also mention the fact that we had some few weeks ago, prior to the UN High Level meeting, we had a national high level meeting, which we call the 7th high level meeting on NCD in Ghana, dedicated have that kind of discussion so that this regularly we'll be having meetings to track progress to see how Ghana is doing. And then also, like our president said, we should put pressure on them, put pressure on us so that we can. countries continue to provide the needed services for us all. So, okay, so in terms of overview, I think that I'm not believer the point on this one, but just to mention that the first HLM is the fourth of its kind. The first one was in 2011 when the UN then saw that there's a need for us to recognize the need for NCDs to be given that political, political lens. Let me put it like that. So in 2011, then the first UN HLM was held, same in the UN, around the UNGA. And then in 2014, there was also another meeting that looked at progress that we have made from 2011 to 2014. And then another set of, commitment and declaration came up. And then in 2018, I had a meeting. And then at that meeting, we heard that the next meeting is going to be held in 2025, which happens at two weeks ago. September, now it's 400 weeks. That's 7 years more. Some of us, when there were a lot of cry, a lot of disturbance, so certain to comment. Why 7 years before we prepare progress on NCDs? We thought we pass in a short time so that we can quickly come back, review progress and then make other commitment. But that's what we had. This time around, I'm not sure when the next final meeting, but hopefully I'm sure it's going to be around when the NCDs are expiring, which is by 2030. Right, so the NLM week, and then also in 2018, that was where mental health was really now introduced to be included into the political spectrum. Because all this while also mental health was also relegated. But this 2018, it was then brought into the political system. So it's also been looked into it's also been looked from a political lens. So now we have SD and mental health. Before it was just SD. Now mental health was introduced in 2018. And of course it's also reflected in this year's UN political declaration, which also have mental health. So it represents a renewed global commitment to transform livelihood through leadership, equity, and integration. I'm sure that the points are well familiar. Right, so it centers on the theme equity, integration, transforming lives and livelihood through leadership and action and NCD, and the promotion of mental health and well-being. So mental health kept coming throughout. And then, okay, so we will look at the global commitments. Briefly, like I said, it was held in 2020. 2025 in September, right? So great health promotion environment and through action across government. So that was one of the major highlights. So it's also to ensure that government commits to multi-sectoral action. Before so we listed all of them. I'll just mention a few of them so that we can make some connection, especially those that were mentioned has to do with Ghana specific, probably Africa. Right, so address poverty, nutrition, and social exclusion by ensuring universal access to education, decent work, so all of them were all encapsulated. Implement fiscal and legislative policies. And in Ghana, we know we've done some work on that. I know the Ministry of Health will highlight on that. So introduce or raise tobacco or alcohol, taxes. Unfortunately, there were some few issues that we had at the UN meeting, but I'll mention them in detail at the end. But then you will see that we have tobacco, alcohol, but ultra processed foods have not been mentioned here. And the reason why they were already in the original text, as was mentioned by Jessica when she was presenting. So it called on member states to focus on introducing taxes on tobacco and alcohol, to meet the health objectives, and then also to implement comprehensive tobacco and nicotine control measures. Because currently we are seeing the introduction of new emerging tobacco products like nicotine delivery system, like the vapes and electronic cigarettes. And that's why there's a need for nicotine delivery system, right? And then non-nicotine delivery system, the N's and the N's. So these are the new ones that are being introduced now by the tobacco industry, right? It also call on us to promote healthy diets through fiscal initiatives. Again, taxes on mandatory commodities. Front of pack warning label. We should emphasize on grass fat elimination. We should focus on food procurement. When government is going to procure, food for our children, they should make sure the food that they are procuring is not ultra processed. It is devoid of, non-communicable disease or diet-related diseases. And then also health services, right? Particularly, looking at children. And then there was also a need for government to implement the Global Alcohol Action Plan, which was instituted by the WHO on alcohol. And I'm happy that I'm told that we're going to an event tomorrow on alcohol. It's also a good thing. And then strengthen air pollution control and environmental, issues. So these are all some of the key things that came out. Prevent suicide, promote healthy health and aging and active aging. And then this has been one of the called by one of our members, the fact that we are not prioritizing the issue of aging in this country. And I'm told that this is a bill that has been pending for years and is still lingering on. I don't know why we are not pushing it out to get it passed. I don't know if we want transition and get there. We shouldn't leave it for those who are retired. We must force and ensure that Parliament also gets it passed. And this is an area that is also a concern, even to the global, it has been given that kind of political name. So we need to ensure that we are doing something in that regard. Right. And then also load resilient PAC. And I'm sure the Bishop will talk on that as well, on what Ghana is doing around PAC. And then expand, community-based care. Which Ghana is doing extremely well on that as well. The issue of the, cheap compounds now integrating it within the NOPs, the network of parties, which is also a good thing that Ghana is doing. And many countries are learning from us. And then we also want to scale up, prevention and management priorities for NCDs, cardiovascular diseases and cancer. So there's a call for countries to renew their commitment. Maybe I feel they should renew their commitment to get it and invest more money. Current challenge that I know that we are getting more support from the donor community to advance these things. But there's a need for government to see how government of Ghana can dedicate more resources to advance that. Especially the further introduction of the Ghana Medical Trust Fund. And we are all hoping that there will be that kind of strategy on getting more resources to implement it so it doesn't become a white elephant. But I know that there's so much commitment from the government to get that done. Right? There's an introduction of oral health. I'm not sure if somebody, have seen, our dedication and commitment to our oral health. I think that one is virtually dead. Yes, the mission of policy that's not dead. Maybe when they come, they are, but I'm speaking for where I'm coming from. I don't know, when you come, Prince, I wanted to see when you come, when you get an opportunity, you come here and you talk about you are on the program and you defend because I know that I don't know if national insurance covers oral health. I don't think it covers it, and this is what I'm talking about. How do you make it? Because now many of our children are having cavities problems because of the excess use of SSB, unabused sugar sweetened beverages, coffees in our system. So we need to. So that's why there's a call. To prioritize that. I know that our NCD policy strategy have highlighted the need for the country to prioritize oral health, and I think even sites. But when you get an opportunity, please, you tell us what the mission is. Thank you very much. Finalizing the strategy. We are not finalizing the strategy. Okay, great. So at least it's a commitment, right? To getting something done. Right, and then also develop and implement preventive care, because this aligns, directly with the mama care. So mama care is going to focus on chronic, non-communicable diseases, and then strengthening the healthcare workforce through training, and that's also very important. And then promote equitable access to, the WHO recommended essential medicines. That's also very important because of our NCD medication. How do we ensure that we are getting them more frequently, and then people are not paying much. Because we're talking about affordable pricing, but currently they are quite expensive. Those are supposed to be cheaper. They are still expensive. And I know that there are efforts to reduce the prices or making available free of charge. And encourage innovations.
So recognize that NCDs and mental health services remain underfunded. I mean, very important. I think we're also with the mental health authority last week to have a discussion around some of these things. How, I mean, we can all together support ensure that mental health is given that kind of priority at all levels, not only at the Ministry of at their own level, but at least expand it everywhere, and then allocate adequate and predictable sustainable resources. This is where issue of taxes comes in predictable because earmarking of these funds are very predictable. They are able to know how much revenue you are getting every time. Unfortunately, it's becoming difficult for Ghana to accept the fact that we're going to earmark some of the resources we are currently getting from the excise taxes of tobacco, alcohol, and sugar-sweetened beverages. Currently, Ghana is getting about close to about 3 billion Ghana cedis from the excise taxes. We are saying at least even if half of it is earmarked to support, we will have some reduction in alcohol. And there's a call even by the WHO that countries should at least should dedicate at least 50% of whatever they are earning for the excise tax to support, the drinking donor, discourse we are having at the moment. But then enhanced domestic revenue regulation again is here, and I'm happy that the matter around number 3, enhance domestic revenue mobilization through fiscal measures such as tough taxes on tobacco, alcohol, and unhealthy products. And for me, I'm happy about unhealthy products because that's what's killing us now. More the ultra processed food that we're having in our system, the unpacked, so many of them, and they don't have proper, effort to pack one, to warn people about what they are eating. I know there are efforts around this to share this done at the ministry level, and hopefully we'll get it done as soon as possible. I'm talking about the front of our warning policy that is being currently being worked on, as well as marketing restrictions policies, and also procurement and fiscal policies. So hoping that at least you add a voice to that, so you can get this thing passed as soon as possible. I know the PPM is also here, but I know that's within the PPM's office to handle that, right? So that, when we are going back to the next high level meeting, we are able to present something to the world like this. And from here, Ghana has done A, B, and C to demonstrate to the world now. And then increased funding on mental health, it also come out. So how are we increasing funding on mental health? If there are some reflection on that, we'll be here. Mental authority can share with us. If there are increased funding for mental health, the Minister of Health is here to tell us if we have invested much on mental health. Recognize the chronic underfunding or underinvestment, and then also utilize external assistance. Again, though it is dwindling, we should see how we can still partner with private sector, relevant private sector, and then also with government partners to support our core. And then implement financial protection mechanism to reduce out of pocket payments. And this one resonates more with our people living on communicable disease. How to ensure that we reduce the extent to which they dip their hands into the pockets, to finance their health care. Sometimes I see that, diseases that sometimes they have no control over. They have no control over. Because if you don't make them, the way they purchase them. So if government don't, restrict the coming of these products, the system will consume them and they will force it. So always I say the battle with the government, to end the issue by controlling our orders, putting taxes to reduce certain unhealthy commodities from coming. Right. So we need to also protect who are with NCDs as much as we can. And then strengthen governance. So develop and implement multi-sectoral action on NCD and mental health. So I'm sure that Ghana is very good at that. The governance structure, it is well in place. How to activate them so that it is implementable. That's why I think we're having some challenges. But I know with time we would be able to make some inroads. So ensure the national priority strategies are costed and budgeted and linked to broader health emergencies. I know that many of our strategies are also costed. I know that even the Ghana, the national policy and strategy was properly costed. So we have to now go into whether, we've got more investment to get it done. Because I know that by next year the policy is expiring, and definitely we need to reorganize ourselves and then review it. Right? But we need to do an analysis see whether we've been able to implement key aspects of the quality and strategy. And then promote more of government and more society approach. Like NCD is not one person matter. It's not the Ministry of Health. All sector are involved, and that's why we have the NCD steering committee. Being chaired by the Ministry of Health. That's also ensure that issues of non-communicable diseases are given an umbrella perspective, so that all stakeholders are involved in this. Incorporate human rights principles, because a lot of human rights issues, and NCD obviously is a huge human rights issue of stigma, issue of mental health, issue of discrimination, where one person has no communicable disease, they are stigmatized, they are being discriminated upon. So it's a human rights issue, and we need to fight them as well. And then integrate NCD mental health services into emergency preparedness and humanitarian responses framework. I don't know how that represents here in Ghana, but where there are humanitarian issues, NCD become very, very, very prominent. I know I'm told that they can also have refugees come to Ghana. So we need to prioritize the issue of mental health conditions and also issue of NCDs within that. They need it more, you know. And then also, we also strengthen surveillance, research, and then data collection, and then also build national and regional research, which we are trying, we are doing that a lot in terms of research to understand what the issues are and then come out with, proper recommendations. Those are locally related research, and that's why I would thank the Ghana Health Ministry of Health and the WHO supported to come up with the Ghana's first survey, the recent survey. I know the militaries, they would also give us some statements, which will definitely touch on these areas. And then also foster regional collaboration, data sharing across borders. So if Nigeria have a statistics, why we can also take them and then use them if we think that it resonates with us. And then establish transparent accountability framework to assess progress against global and national targets. Because the SDGs have targets they have. So how do we ensure that we align them? How do we pick each indicator and ensure that we are meeting those indicators? I know NDBCs here, and normally that's what they do for us. So I'm sure they will at least give a hint of how they will be supporting us in terms of data collection, how we will be aligning our indicators, the low indicators to Ghana indicator, and then ensuring that we are closing the gaps as much as we can. And then reflection of civil society in Ghana. So I just give you a background. So this is what civil society, more or less are looking out for. So we welcome the declaration, though it has problems, but largely it is good. Civil society priorities for while we introduce measurable targets, that is made translate into concrete action now. The declaration highlights gaps and opportunities that are, particularly salient in the Ghana context. So I've mentioned them already, which is that clearly it aligns with Ghana. So we need to put in our effort to get that implemented within the space that we have. And then also the fact that the targets are ambitious but very actionable. They are ambitious, so they can we achieve this, but they are achievable. That's if we commit enough resources and also our attitude towards that. And then for Ghana, this requires immediate translation of those global benchmark, international numeric targets, establish delivery milestone embedded in the USC roadmap. Yes, and of course we have the USC roadmap beautifully, encapsulated. How do we ensure that we are able to implement them to Ghana by ensuring that these commitments come into form? And then again, the mama care would always come. From today till but it will continue to remain with us if we make it work. Right, so we need to continue to emphasize the fact that the mama care has come to stay and beautiful mission. If you implement it, it will reduce healthcare costs. It will make Ghana one of the beacon of hope when it comes to health. So we need to embrace the free primary healthcare initiative that was also initiated. I'm sure the Minister of Health will talk more on that. So I'm believer They're actually brand ambassadors for Ghana Medical Plans. So every corner I go, I talk about it. Yes. So please, this one is a call for me. Right. So however, fiscal measures and business declarations such as the high taxes on tobacco alcohol must be considered not only for revenue but also for health. That's very important because sometimes they say, why are we focusing more on revenue? No, the point is that, I don't know what that AGR is saying. They will say that the revenue we are getting is a byproduct of the intervention we want to achieve. We want to reduce the consumption. How can we reduce it? One of the finest and most effective one is taxation. So it's a byproduct. So once you are reducing the things people are consuming and getting the cancers and the diabetes and going to the hospital, you're also getting some revenue. And that revenue you can put it back into other to have promotion. That is all that we're talking about. So not necessarily for financial this thing, right? CSO score also calls that Mama Care or Ghana Medical Classifier is designed itself must safeguard against political capture. And that's one of our major, concern here. I know next week I will definitely speak about it, but just to give a hint, the fact that you see when those initiatives comes out, if you're not very careful, then it will go in the line of the scholarship secretariat thing, where we know that over time, this can become political. So people who don't even deserve it are those who are getting this thing. And the mama care, if you look at it, it looks similar in that shape. But we'll be having another conversation, next week, where we will sit to unpack how the Mahama Care or the Ghana Medical Trust Fund is going to, support to reduce the burden. So together we'll be able. So we are saying that it should be safeguarded against political capture, clear accountability mechanism with civil society are ready to support that, and then also the academia and also development partners. I know GIZ this year they are very good also ensure that we put government into check. And then also measurable and equitable indicators that prioritizes the poorest and most remote communities. Because we are raising a red flag because it may happen if we don't put mechanism to prevent that from happening. Right? And then also urges the Ministry of Finance in particular with the Ministry of Health and Parliament actors to earmark again to earmark the amount of money we are getting for excise tax, at least something small to support whether the Mahama Care or health promotion in general, so that we can have people understand what to do to prevent NCDs from happening. And then also defensive primary health care is one of our major area. And then the chief compounds operation and the network of analytics need rapid reorientation. We need to inject more funds inside. For now, we don't hear much about the network of analytics again. It became a topical issue some time ago. We need to continue to dwell on that, so that because it's a very good thing. Digitalizing your health system is one of the best. And then also good governance and multi-sectorial leadership as stressed in the declaration, because we need good governance as well. Good governance and everything. Once there's good governance, system is strengthened, then we will make a headway. The government should prioritize the adoption and enforcement of comprehensive food policy. I mentioned that already. The mobile enhancement of the Ministry of Health, the front of palm oil, the mobile on our processed food, so that if the food is unhealthy, there's a warning that this one is unhealthy, you decide to go and take it. So I will have more of our healthy staff, in the system, so people are able to identify which one is healthy and which one is unhealthy. That will also help the industry to eventually, reformulate. I don't like reformulation because when we go up and come down, if you have 10 cubes in Coca-Cola or soft drinks, and you take 5 from inside, the harm is still there. You just reduce the extent to which you go to hospital. So if you get diabetes maybe in 10 years time, if you get diabetes in the next 5 years, it will reduce 10 years, but you still get it. So, but the point is that it will help us to get more healthy staff in the system if we are able to do that. And then include these regulatory measures that addresses both availability and marketing of healthy products. Again, one key thing I highlighted here is the fiscal activity we are developing a blueprint or a document which we will share with everyone to adopt. So at least if in Ghana every institution adopts maybe every month for one to discuss activity with the staff, it helps to reduce the stress and also the NCDs. Because we are told that sitting for a long time or sitting is now being equated to tobacco. How devastating tobacco is. So sitting long time is also causing a harm on our health. And that's why for us here, you will see us also doing physical activity in some few minutes. Right? Yeah, so little, you don't have to stressful one. Just walking, cycling, dancing at church, anything that can make you move the body that mama gives you, that will give you. Right? And then also this governance architecture must incorporate the mechanism for meaningful involvement. And I was happy that even the statement that our minister made at the UN level meeting, it captures some salient points. It captures the fact that we have to meaningfully involve people living with non-communicable diseases in decision-making processes. And I thought that was a very, very good clarity, because at the end of it all, everything we are doing here is about ensuring that either we are preventing this from happening or ensuring that we take care of people who are living in the condition. What is to bring them at table and then draw with them. The discussion should be with them. But unfortunately, that is not resonating very well with us. And that's why we are going around with some institutions to discuss the WHO framework for meaningful engagement of people living in cities. Because the WHO come out with a very beautiful document. The actualization is what we are looking at right now. So we are now waiting for institutions to see how institutions can incorporate that. At least get one or two people living in cities in your workplace, because many of them are unemployed and they're just surviving on friends and families. So we need to do like we are doing, right? So the liberation ambition will succeed if only succeed only if accompanied by clear sequential national plans, a milestone for 2026, 2028, and 2030. So if you want to have so if South Africa dedicate some days, maybe after every year we convene and then look at how have we fared as far as the political liberation is concerned, and then also benchmarking it with the 2030 agenda, which is the UN SDGs. Right? Now, of course, this thing didn't go without industry. The industry were, in fact, they were at arm. Because initially it was subtle. The first declaration that came was beautiful. In fact, if people that adopted, oh my goodness. But the second one that came, in fact, it was worse. The main things were removed from it. Only how come a document that has gone, then when the revised came, many things were removed. Then the third one came, then it was a bit better. We were still complaining. Then the final one came. You can understand when you have countries that are in support of industry survival. So that's why the US eventually objected. In fact, they raised so many concerns in the declaration. At the UN high level meeting. The minister is not here. Probably he would have given us experience on what happened. But it was very, very devastating. To have that a political document like this, which has beautiful provision that will reduce poverty, reduce anger, reduce the suffering of people who go to hospital, but rather to reduce the profits of the industry, it didn't fly easily. So there were pressure from tobacco, alcohol, and other processed food companies is stopping government from putting in place life-saving mechanism. By the WHO said this, after the whole conversation, this is what the WHO said. And then the WHO says government often face intense lobbying. Yes, and government sometimes they face intense lobbying. It's not easy, to have some of these policies to go through without the industry knocking at your doors. The point is whether you accept it or not, that's another issue. Right, the WHO statement said that governments often face intense lobbying from industry trying to block, breaking, delay, from range of health taxes to monetary restrictions. Because I think the fear was marketing. Because if you stop the industry from marketing, in fact, they will kill you, or they will do everything to prevent you from achieving that. And then they will also ensure that the taxes does not fly, because they own their taxes, so they won't allow taxes to fly. And then also the WHO director general himself told So the WHO should not fear dialogue. But WHO doesn't fear dialogue, right? It should welcome it. So says Philip Morris. I mean, the giant producer of tobacco and other, new and emerging tobacco products. So instead of they should open the gate for them to dialogue with them. But we are saying that we cannot dialogue with the tobacco industry because for them, they are producing killer product, it has no benefits. At least if it's even automotive, at least better to say tobacco. And product have been declared that has no benefit whatsoever. All it does is kill, destroy, maim, no benefit whatsoever. Still that will put you to do what? They are even like that because they've been able to get, world trade, whatever, to get their product in there. Otherwise, would have eliminated them long ago. But they are still, they are still speaking, So yeah, so that's what Clement is saying. Now, so this was what they were saying during the discussion when the political declaration was ongoing. There were intelligence that were picked on what they did to subvert or weaken the policy. Now, Henneken, you all know Henneken, right? Those who like watching sports. Sometimes I wonder, I wish I have the minister of sports here now. Asking what's the correlation between sports and alcohol? Me, I've not seen any. Maybe the minister can tell me the relationship between sports and alcohol, or mental health. You can tell us. You can tell, right? Or sports and alcohol. But I thought that for when you take alcohol, it's impaired your vision. But these footballers must be strong and active to be able to do the work. You understand? But throughout the sports medium, the league is not going. You see, sponsored by Henneken or sponsored by Formula One. Formula One is tobacco, right? It's a lot of people who sponsor this. And so I ask myself, if you come to Ghana, you have the same thing. Sometimes you even have the loan. Is sponsoring sports. Sometimes maybe I need to understand the relationship. So when you come, you can tell us the relationship, right? So Henneken, the person told the Reuters that it did not seek to weaken the UN agreement. So they said they didn't seek to weaken it. What they did only was to ensure that it was both effective and fair to the industry by providing robust science and added that in this results in better policy. So they are happy about the current drafts. So you see, when industry is happy about something, it tells you that that thing is not good. Because it means that they've been able to integrate to get to so that the implementation become a bit weaker. So that's what they did. But we are saying that it's still the number is still good and still have us to achieve certain things. But they were involved in watching it down to some extent. And then the International Alliance for Responsible Drinking, they also have their branches in Ghana. We call them how do you call them? Something for responsible drinking in Ghana. It's being headed by one Bone. Bone. It's called Bone. They also are responsible drinking agency in Ghana, like the civil society, or drink. So they call it Drinking Association of Ghana or Alliance of Ghana. It's a group. So they also said, this is a big one, it's a big international decision. They have branches all over the world. They said the changes made to the health targets reflect government's. I said it again. It reflects our position when we went there. That's what they are saying. It reflects government's recognition that an approach that distinguishes between moderate and harmful consumption, such as drink driving. So what they are saying is that for them it reflects the final quality. It was a good thing that this thing happened. So what they are saying is that for them, moderate drinking is not a problem at all. You see, they didn't say drinking, they said moderate drinking. But what do we see? People drink, madam. Right. But what we are saying, and that are saying is that our counterfeit, again, the same group is saying that they have increased their organization funding to play a more active role in alcohol-related scientific and counter messages coming from health bodies. So we should be ready for them. So in fact, this is what documented that they are investing more money. To what, or to this what they have declared they are going to do. And it's there, it's there. So when you go, you find them, right? And it's not coming from routers and other public, I mean, publications, right? So we also have the WHO that also said that the body had to address the main cause of ill health from alcohol, and then also, that we need to have strong languages on alcohol and air pollution because apart from tobacco and then also what is it, ultra processed foods, air pollution is coming out strongly, and we need to be very, very, very mindful of that because I'm told that Ghana, Accra is one of the filthiest in terms of air pollution in the country. So I mean, at the global level, so we need to be mindful of that. We are breathing air, but what we are breathing is toxic, so we need to be mindful of it. But there's an agency that measures the extent of dust and pollution in the air, and this is what is telling us. So we need to be mindful of it as well. And the alcohol maker says the science is more complicated and shows drinking in moderation is low risk. I don't know what it means say drinking in itself, but I said drinking moderation is low risk. But they don't produce in moderation, they produce quantities for people to drink. And that's where the problem is. If they will only emphasize and then produce mini bottles, but the big giant, sometimes I think a drum, and they try and put them, people are just drinking, to die. Right, so the WHO against the other health institution continue to say that, Manapat, I want to listen to this one. It says that say drinking sometimes, even in small amount, is linked to higher risk of certain cancers and other diseases. In fact, so this is what they want to fight. They say they are investing more money to debate and then to counter what we are doing. In fact, they say they want to counter the ministries of health because they're health institutions. So this one, they're going to fight straight on your doorsteps. But we're ready to support the ministry and other health institutions too. To diffuse those claims. Right now, so finally, the unity we saw. So this one is from our global president, the Global NCD Alliance. Right after the declaration we didn't get unanimous, acclamation for it. And this was, she said, the unity we saw today proves that most governments are ready to take their baton on NCD. We stand by the call to lead and urge government to deliver with national action and accountability. So despite our little frustration, we felt that no, we still need to commit to what we have and then get it better. Then it says that the declaration is not perfect. You see, like I said, the once industry is involved and they're giving the green light, definitely you will not have, a very good, but if you stand firm and then stack them away, they will be able to make progress. But for the UN system, everybody is invited. You can remember doing the multi-stakeholder hearing. The alcohol industry were there and they even made statements. I was there and they made statements. Support what they want to support and also debunk what they don't want to appear in the medical declaration. Right, so it seems like it's not perfect, but it remains an important step forward for global health. Now, it represents months of negotiation. If I was thinking years of negotiation and collaboration among government advocates and the civil society engagement throughout, because we have to engage governments and other stuff to get to where we are now. Millions have spoken and they are right to demand more. Indeed, we have the right to demand more from everywhere. We need committed leadership, clear accountability, and urgent investment to close the gap between commitment and change. I think that's a very good, current call. So I'll end my presentation here. Thank you very much for your attention. And to say that the time to lead is always now. We need to lead now. Thank you very much for your attention. If there are questions.
Oh, let's do it better. That's my boss. All right, so just a quick one. Does anybody have any question for him? Yeah. I thought the man has not exhausted his speech. He wants a follow-up question to clarify and share more. Any question? All right, so Laurent, thank you so much. So in all of those, there were two things I caught, and those things I know are passionate. One is passionate, you are passionate about it. The other is also what I do, because I'm in charge in the office. When I had the opportunity, was it 2 weeks ago, at the ministry, when we had the D card, yes, I had to articulate those views as well. That's the call for vigilance on the growing industry interference by the tobacco, alcohol, and the ultra processed industry. You made mention that they block or delay life-saving policies. This is true. The industry is very subtle. They have the cash. There are people I speak to. They work in the CSO space. When you ask the question about Charlie, are you sure when the industry comes with money, you will reject them? They work for money. Yes. Yeah. But then let me share this life and true story in the office. Our previous office, there's this oil company. They keep coming to our office to engage with Labram. They want us to do advocacy on the work they do. And the money they brought was huge. But Labram always refused to engage them. We keep telling them that what they are bringing on board conflicts with what we stand for. Yeah, we are not for industry. The money was huge, over $100,000, but we kept telling them no, we are not ready for it. I don't know how many of you will reject $100,000. Just go and speak for somebody for 6 months, and then you keep them out. But that involves an issue of integrity. You must know what you are called to do. And then the second one has to do with National Physical Activity Day. I look forward to that. I look forward to that. Then I'm putting up a proposal at the meeting the last time. WHO asked me to put up something to share with them. And so I'm working on that. Not finished yet. We need to have it. For those of you who live in the suburbs, it's something common. Yeah, people normally come out in the mornings, but in the residential area, where people are very busy, there's a presidential area. All right, so people are going to from the house office back home has become a challenge, but then it's something we need to do because yeah, I love working from the scriptures. It says bodily exercise profits elite. So there is an aspect of profit in exercise. Thank you once again, Abraham Musa. We are grateful for that. Passionate leading the CSOs all the time. We want to also receive our next presentation. So we have two more presentations and we'll take our solidarity message, after which we'll have our keynotes address. So from the BPME of MOH, it will be sharing on the government participation at the 40 and high-level meeting and national priorities emerging from the political declaration. So some of us were not there, or most of us were not there, but some people were there. So they want to share with us basically what transpired, what were the observations, and then looking forward what Ghana can, learn or build upon. So if the rep of the PPME is here, this is the moment we want to have you to share with us from the PPME MOH. Okay, madam, thank you so much. Let's welcome her with a clap of praise. Your clap is good. Yeah, thank you so much. Thank you so much. Probably you can do more.
Good morning, all. Please, my name is Rita Tando from the Ministry of Health. I'm doing this presentation for the Director PPM, Dr. Belinda Efi Mumako, who sends her regards and wishes us a successful stakeholder forum. I'll skip the background. I'll just share a little bit of that because a lot has been said by Mr. Labra. Non-communicable disease such as cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases accounts for over 70% of global death. Mental health challenges continue to raise impacting productivity, social well-being, and national development. And in view of this, Ghana partook in the fourth national high-level meeting on non-communicable diseases and mental health. And this happened in September 27, 2018. After this engagement, Ghana has put in place certain mechanisms that has achieved a lot of results. And these are what I'll walk you through. The government of Ghana, with the Ministry of Health, joined member states to reaffirm commitment to combat NCDs and promote mental health. After the fourth UN HLM meeting, Ghana has achieved some key strides, and most out of them, these are the remarkable ones as the ministry would like to communicate to these stakeholders. We have developed and implemented a national NCD policy and strategy plan between the period of 2022 and 2026, which will end in 2026. We have integrated NCD and mental health services into our primary health care service. We have established screening programs for hypertension and diabetes and cancer. We have also strengthened community-based mental health interventions throughout the ministry and also through the Mental Health Authority. Ghana has emphasized the need for strong collaboration among partners in financing and ensuring equitable access to health care. As our previous presenter, Jessica, alluded to, the declaration, the political declaration has still not been signed into. But what it hopes to achieve is that upon adoption by member states, as the member states were to act to accelerate action on NCD and mental health, and key elements included strengthening national leadership, governance and accountability for NCD and mental health controls, expand health promotion, prevention and early detection strategies, ensure affordable, equitable and quality access to essential NCD and mental health services, and also mobilize domestic and external resources for sustainable financing. And finally, promoting whole of government and whole of society approaches, including partnership with civil society and private sector, which Mr. Labaran really emphasized during his presentation on how to get the whole government and whole society approach through the exercises he's putting out and through some key elements he raised. So far, Ghana is also leading a lot of things to ensure that NCD, the actions that were supposed to be adopted, are integrated into our ministry. Some of this borders around policy. We are hoping to mainstream NCD and mental health objectives into national and sectorial development plans. We are hoping to strengthen coordination roles of the Ministry of Health and the NCD control program. Under the health system strengthening, we are hoping to improve capacity of health workers for early detection, diagnosis, and management. We also hope to expand health infrastructure and supply of essential NCD medicines and diagnostic tools. In the area of the universal health coverage, we hope to integrate NCD and mental health services into the national health insurance in which I believe we have. We also hope to remove financial and geographical barrier to accessing healthcare under NCD. Under data, research, and surveillance, we hope to strengthen national information system for real-time NCD and mental health data. We also hope to support operational research for evidence-based decision, which is very critical in our current health system that we are maneuvering over. Data is key because before you take action, you need data to support whatever you do. You need to run analysis, cost benefits, evidence to ensure that where you are putting your money, you get the projection, you get the expected outcomes from there. In the area of health promotion and community engagement, we hope to intensify public education, which we have done since 2018. We've done a lot of public education about NCDs, which this current government has been taken into upon itself to establish the Mahama Care, which Mr. Labram showed a lot of light on, so I will not delve into that. We also hope to partner with community and faith-based, which we have done as a country. We have intensified those actions to address stigma and social determinants of health. And as Mr. Labram, my earlier presenter, alluded to, we need partnership from all angles. So as a ministry, we have partnered with the Ghana NCD Alliance, World Health Organization, World Diabetes Foundation, and through the DCAD African project. We are championing the cause of NCD in every angle we can as a ministry. stakeholders, which is Madam Brown has already laid down the foundation and built a lot of scenarios for us to assess during his presentation. And finally, we hope to strengthen engagement with civil society, academia, and private sector for sustainable implementation. This partnership reinforces Ghana's role in the United Nations Fourth High-Level Meeting and the follow-ups we have, or we had to, which we have as a country. Next steps, by way of next steps, we have already been told that Ghana has achieved a lot under NCD. But as a ministry, this is what we want to communicate to our stakeholders today. We want to translate commitment into actionable strategies within the national NCD and mental health framework. We hope to monitor and evaluate progress using national indicators aligned with the SDGs. We hope to mobilize finances and technical support when it comes to NCD, as Mr. Brown was talking, I realized that financing was key. So as a ministry, we are hoping and putting in strategy to ensure that we can mobilize funds and technical support from our donors, from the public and the NGOs to support us to finance. Sometimes we come up with beautiful plans. I was discussing earlier with one of the NC committee member here. We come up with very beautiful plans and they just become plans. Putting it into action requires a lot of financing, which we don't have. But as a ministry, we want to champion this and we are hoping to put in strategies to address that. We hope to host regular stakeholder review, which we have started with the NCD star committees and the National Steering Committee. But we hope to do more frequent meetings to address the issues of NCDs in Ghana. We hope to prepare for the next UN high-level meeting, which is, I think, proposed for this year. Has the date come out yet? I don't think so, but this year there was supposed to be one. Okay, expected outcome. We seek to strengthen political leadership and accountability for NCD and mental health programs. Improve access to quality prevention, treatment, and care services. Increase awareness and reduce stigma around NCD and mental health, which as a country, I think we have come a long way in reducing stigma associated with mental health and the NCDs. We hope to enhance multi-sectorial coordination and resource mobilization, and also put in place measurable progress towards the SDG 3, 4, and 3.8. By way of conclusion, Ghana remains committed to implementing the outcomes of the political declaration and advancing the global NCD and mental health agenda. The Ministry of Health continues to lead with strong partnership, which I know most of our stakeholders here will agree to, and provide innovative strategy regarding addressing NCDs in Ghana. Finally, together, through coordinated action and shared responsibility, we can drive sustainable progress towards healthier living and lives and community. Thank you very much.
Thank you, madam. Can we do it better once again for her? PPME, thank you so much. Yeah, there are times some of us when we sit back, we feel like nothing is being done until you meet the people to share with you what they are doing. Yeah, it's typical of every human being. When you're not close or you are not involved, you feel like there's nothing happening. Well, once you get closer and you get engaged, you realize people are really working. The challenges you see from afar or within your organization, it's also everywhere. Thank you once again, PPME. So now we're going to take our next presentation. And also, as we are going to introduce the next presenter, I would want to urge all those who will be giving the brief statement to also prepare so that they can share within 3 4 minutes, the brief presentation, so at most 5. Thank you. So we want to hear from one of the strong pillars we look at when it comes to issues of health globally, that is the WHO. So the WHO Ghana reflection on the political declaration in the context of Ghana's health agenda. Yeah, so the rep of WHO, if you are here, let's have you to share with us briefly. Thank you so much. Let's welcome him. The clap is here. Thank you.
Thank you very much. When I was asked to come for this particular engagement, I didn't know that we were supposed to have a statement. But I bring you greetings from the country office and also the NCD program, Dr. Joanna Hanson, who was supposed to be here in person, but one or two reasons she couldn't be here, but she asked me to represent the program. And I believe looking at what previous speakers, right from Jessica to Abraham to the PPME, MOH, have laid what's the global commitment with respect to NCDs and mental health and I don't want to go into that again to waste so much time. But you know, WHO work closely with the Ministry of Health and its agencies, Ghana Health Service, the NCD Alliance, and other partners to support Ghana's agenda through strong partnerships, which most of the speakers have spoken about in terms of having strong partnership with all the relevant agencies and institutions and development partners as well. And the recent high-level discussions and strategic meetings have reinforced our commitment to advancing Ghana's health priorities, improving healthcare delivery, and also ensuring equity to quality services when it comes to NCDs. And we have seen that over the years, WHO has supported the Ministry of Health and its agencies to generate a lot of evidence. Tim Abraham talked about the STEP survey and other evidence that we have generated. And based on these evidence, WHO is supporting to implement certain key interventions to support NCD. And I think one of it is the food policy bundles that is currently underway. That's Abraham did talk about. One of it is the implementation of the global regulatory and fiscal capacity program, which we are supporting the Ministry of Health and the other agencies to implement to improve healthy diet and physical activity. And through those interventions, we have been able to mobilize all key actors within the nutrition space, every relevant stakeholder from transport, from the Ministry of Justice, the Attorney General, every relevant organization who needs to be on the table, we were able to bring them together to draw an action plan for Ghana in terms of how we can improve physical activity and healthy diet in Ghana. And I believe some of these activities will bear fruits as we move along. In terms of capacity building, we've also tried to build capacity to support the ministry build capacity of service providers, managers at different levels. And I think I heard the last speaker from the PPM talk about the DCAD project, where we are trying to strengthen evidence data collection when it comes to diabetes, hypertension in this country. So we are supporting in that direction. And also health financing from Jessica's and LeBron's presentation, we did hear about the health taxes that we are trying to see how best we can advocate for some of these taxes to be used to improve um, NCDs in the country. So by working together, as we can hear from all of the calls, we believe that the government of Ghana and other partners um, will stand a very good chance to drive impactful health initiatives and support policy implementation to achieve sustainable health outcomes and also to improve NCDs generally in Ghana. Thank you very much for having us.
Thank you very much, sir. Can we do it better once again for him? Yeah, I love people of such character. Let me give you a background why I made that statement. In my church, I happen to be one of the council members. Every Sunday before I go to church, I prepare on my own. Yes. Even though I know my pastor they want me to pray, but I prepare on my own. In the event there's a delay, I have to step in to do the right thing. When you read Ecclesiastes chapter 4, verse 9, it says, two are better than one, because they have a good reward for their labor. If you sleep alone, you don't enjoy that you are double. Two is always better than one. It's not what you are thinking there. Yeah, so, but then, from the way we did this presentation, you can't do something about PhD. They cut across almost every sector or every aspect of the work we do. And he's been able to manage and tell us what they've done and what they are supporting. Alright? So if you are here, you are representing your boss, take this lesson from me. Anytime you are going for a meeting, you prepare ahead of your boss. Your boss can tell you, maybe you will this with LeBron. We go there, he never tells me I'm going to present. So go and handle it. Yes. I was in a similar meeting in the Ministry of Health, where I was not told I was going to present. All I did was to go and represent the organization. And I was called. The rep from Ghana NCD Alliance. Immediately I heard my name, my heart put the way the NCDs would tell me. But then I went there and I heard a piece of paper that there was nothing on it. But I made a nice presentation. People were clapping for me. Yes, so that is a blessing for us. Thank you so much once again for the WHO. Alright, so we want to have our brief statement from our partners. Alright, so once my boss has stood up, it's a signal. He said we should do physical activity. So please, wherever you are, be outstanding. I can see some of you look done already. Let's shake our body. Yeah, let's shake our body. Yeah. Alright, so wherever you are, if you want to maybe you can do that within 3 seconds and come back. But if not, let's watch me the way I'm doing it. Just keep the body busy. Yeah. This is not our usual Thursday, okay. Yeah. Alright. Probably you go this way, up and down. Slowly, slowly, at your own pace. At your own pace. If you were to be in the office, there are certain terms that we use. Nobody that hard work breaks no bone. Okay, so shake your legs wherever you are. Yeah. You can take your seat and clap your hands. By way of this, I'm inviting you on 12th of December. We are pitching camp with the Ministry of Health. We are going to engage in the UAC Day. We will have a physical activity session. And then the following day is the National Great Walk from Ayi Mason to a brief. If you are ready, you can connect with the Ghana NCD Alliance. We are fully going to represent. Let's walk. Yeah. Thank you so much. Alright, so the first on our bill, brief statement from partners aligning the political declaration with national priorities and institutional rules. We want to hear from a man I experienced the second time. I've met him first time, but the second time was very enlightening. Even when I saw him, I was like, this is a very deep man. I spoke to my boss how we can engage him going forward to push for the issues of mental health in Ghana. So we want to hear from the Mental Health Authority, Dr. Michi, so we can share the solidarity message with us. Thank you. Please, he likes fun, so clap for him. A very simple man. Thank you so much.
Thank you very much. Some people want to say what protocols said. And thank you for this opportunity. It's quite unfortunate we have to state NCD and mental health. Because the bulk of NCDs are mental disorders. But it looks like when we talk about NCDs, people still think of the cancers and cardiovascular. So now we have to add in mental health so that people will be reminded. But the spirit of Niger, and for those who don't speak Ewe, Niger is having the land of the wise, where wisdom speaks not in thunder but in truth. We gather today to remind ourselves that a nation's heartbeat is not measured only by GDP, but by the calm of its people's minds. The world marks in New York for the fourth UN high-level meeting on NCDs and mental health, and left with a call to action. To integrate, to invest, to include, for there is no health without mental health. The commitment I shared earlier basically is to integrate mental health and NCDs into universal health coverage, to invest sustainably in prevention care and research, to implement the range of best practices, survival, alcohol, and healthy living, to adopt a whole-life approach to mental health education, labor, and finance, to include voice of the lived experience, which we commonly live out in Ghana, in every policy that bears their name. For us as mental health authority, at least for the past 2 boards of authority, and this current board, there's always a person with a lived experience in mental health who is at the board level. So these are not words and ideals, they are evidence-based imperatives. Ghana's reality check, the truth is quite stark. We spend only 1.4% of the health budgets on mental health. The recommended is about 5 to 10%. And we lose 7% of GDP each year to mental disorders. Currently, we still have 1 psychiatrist to 400,000 population, and 1.4 mental health workers to 100,000 population. The ideal should be 1 psychiatrist to 10,000 population, 1 health worker to 10,000 population. So we are nowhere close. And in all this, it's not surprising that we still have about 90 to 95% of Ghanaians with mental disorders who do not receive care. That is the treatment gap. So for every 10 people who fall mentally ill, only 1 gets care. 9 of them are left untreated. And when we underfund the money, we overpay through the soul of the nation. Still, there are lights among these shadows. We are integrating mental health care into community services through FCDO support, through youth rate initiative. We are bringing early intervention to young people through our partnership with academia, University of Ghana, UHAS, and other teaching hospitals. I saw Ahmed Jazz here through their hospital partnerships. We are trying to bridge the science and service together. And in Ghana, the priority area of the framework for mental health authority is, we call it the research vision. The research means the R stands for to reach every Ghana with mental health care, every Ghanaian living everywhere in Ghana deserve the quality mental health care. Then we hope to achieve this by integrating care for the psychology students and the doctors in training in mental health. We want to empower the workforce. We want to start specialize and scale up. So we want to train at more places than we have now, and the training should include some specialization. We want to have child mental health specialists. We want to have mental health planners for old age, for addiction, for forensic, for community. And we want to embed mental health. So that is the next C. Embed mental health in universal health coverage. And the last C is to transform stigma into support using technology. So telehealth, telepsychiatry is going to be a major form to help us move away from stigma into support. So the research group is a slogan, is our promise that we will move from pity to policy and from silence to the systems. If mental illness costs us 7% of GDP, then using our investment even by 1% is not charity, it is economic strategy. We must now, one, operationalize the mental health fund. Madam talked about funding, and we have proposed that if we could have centers with extra duty on things like betting, gaming, porn, sugar, fast food, the junk food, alcohol, tobacco. If we get extra duty from these products to fund mental health, we believe that would help fund the mental health fund, which has been established by law. We want to raise the budget allocation, to the WHO guideline, 5 to 10% of the health budget to go into mental health. We want to integrate mental health indicators into every NCD strategy. And one of some we were talking a lot about the mental health of persons going through cancers, but not people with mental disorders who get cancers. We want to protect the policy from industry interference. In nature, we say that the brown bee that stays the village begins not in the forests, but in the hearts of those who choose to listen. Let us be the heartbeats, restoring dignity, soundness, and hope to our people. When the world meets again, let it be said that God will not echo the world's agenda. God inspired it. Thank you very much. God bless us all.
Thank you, Dr. Eugene. Munyadu. Munyadu. Yeah, the wise village, the wise. All right, so National Development Planning Commission, NDPC, the rep is here. Oh, okay. I hope you also leave it. It's not all brief. Thank you.
Good morning. Everyone, I think it's now afternoon, so good afternoon, distinguished ladies and gentlemen. Permit me to standard existing protocols. I'll deliver the statement on behalf of the National Development Planning Commission. We at the National Development Planning Commission believe that this meeting provides a strategic opportunity to discuss how the political declaration from the fourth UN high-level meeting on NCDs and mental health can be translated into actionable commitments within Ghana's development agenda. The declaration adopted late September 2025 represents a unique global consensus to reduce premature mortality from NCDs, strengthen health systems, promote well-being for all. Fortunately for us, these commitments place mental health at the center of NCD and development responses for the first time. These underscore the intrinsic link between physical, mental, and social well-being. The achievement of these commitments calls for bold political leadership, sustainable financing, equity-driven interventions, and a whole of government and whole of society approach, as highlighted by the previous presenters and those who give the statements. As most of us know, NDPC sits at the apex of Ghana's national Commission plays a central coordinating role. First, in ensuring that international commitments are translated into actionable objectives and strategies within national policy and planning architecture. In line with our constitutional mandate, the Commission also ensures coherence between global agendas, of which many of us in Ghana is a signatory to a number of them. So we ensure coherence between these global agendas and Ghana's long-term and medium-term policy directions. Through our coordinating function, we have worked closely with several ministries, especially the Ministry of Health, to first and foremost integrate NCD and mental health priorities into successively the national and policy frameworks. So this, over the years, has translated into the planning and prioritization of mental health and NCDs in sector and district health medium-term plans. The Commission is also involved in the development of a policy bundle, like Mr. Labra mentioned. So looking at procurement policies, marketing regulations, fiscal, front of pack review. So all of these feed into successive medium-term policy frameworks. Currently, the Commission is developing the 2026 to 2029 policy framework. And this framework, like its predecessors, recognizes the rising burden of NCDs and mental health as major public health and development concerns. Therefore, it has identified and outlined strategies to address a myriad of interrelated challenges, including the prevalence of NCDs and mental health disorders, limited access to quality care, stigmatization, and a whole gamut of them. The framework also has additional strategies to strengthen prevention, ensure early detection and management, integrate mental health to primary health care, and increase access on tobacco, alcohol, and unhealthy foods. These actions are implemented by efforts to enhance multi-sectoral collaboration and health promotion to improve lifestyle choices and reduce exposure to preventable causes. These interventions align with Ghana's commitments under SDG targets 3.4 and 3.8, the African Union Agenda 2063, and the ECOWAS Health Policy. We also underscore our collective responsibility to promote mental well-being, prevent premature death from NCDs, and ensure equitable access to quality and affordable care for all. Like with our previous commitments, upon adoption, the Commission is well positioned to translate the political declaration's commitment into measurable national actions, establish clear rules for implementing agencies, and ensuring that sectoral plans and performance frameworks reflect targets on NCDs and mental health. The Commission supports the development of evidence-based indicators for tracking progress and promoting accountability through evaluation and reporting mechanisms. NDPC will continue to engage civil society like we have done, development partners, academia, and the private sector to strengthen implementation capacity and data systems as we recognize that addressing NCDs and mental health priorities requires both technical and social innovation, leveraging on partnerships we have, community engagement, and locally responsive plan to ensure that everyone is left behind. NDPC therefore encourages all sectors and all actors to align their actions and investments with national priorities and work collaboratively towards achieving a healthier and more resilient population. As we deliberate today, let us focus on defining actionable pathways to operationalize these commitments and align our national, sectoral, and local level roadmaps with the outcomes of the fourth UN high-level meeting. Together, through coordinated planning and implementation, evidence-based interventions, and sustained political will, we believe that Ghana can make meaningful progress towards achieving the SDGs and improving overall health and well-being of all. Thank you.
Thank you very much. Let's do it better once again for him. Alright, so if you have the rep of the National Health Insurance Authority here, do we have them here? Alright, if not, NCD program. Oh, okay. women right presents. Great. Thank you.
Thank you, MC. My name is Dr. Naomi Apia from NCD Prevention and Control Program, the Ghana Health Service. My speech is really going to be short. Distinguished colleagues and partners, good afternoon. On behalf of the NCD Prevention and Control Program of the Ghana Health Service, I want to thank the organizers for this opportunity to deliver these remarks. The recent UN level meetings on NCD and mental health renewed global agency for stronger integrated actions. While consensus adoption was disrupted by one member state, the message from the world remains clear. NCD and mental health are defining health and development of priorities of our time in Ghana. Our reality is sovereign. The 2023 WHO STEPS survey shows that 1 in 3 adults has hypertension, 1 in 5 is at risk of diabetes, and over 40% are overweight or obese. NCDs now account for 43% of all death, cutting life short and stunning families and our health system. Our priorities as the program, with support and guidance from the Ministry of Health and partners, we are taking these bold steps to respond. 1. Integrating NCD care into primary health care, ensuring early detection and treatment for the community. 2. Rolling out the NCD tracker for better data management and patient follow-up. 3. Improving access to screening and education. 4. Building cross-sector partnerships with agriculture, education, and local government to address risk factors such as unhealthy diet, tobacco, and alcohol use. The way forward. Despite the political pause at the global level, Ghana's resolve remain firm. As a program, we continue to lead with innovation, partnership, and community engagement to reduce premature death and improve quality of life. Together, we can make NCD prevention and control a successful story for Ghana. Thank you.
Thank you very much, NCD program. We want to also hear a brief statement from Dr. Sylvie Berquin, the Director of Public Health, Ghana Health Service, who is representing the Director General this morning or this afternoon. So, Dr. Berquin, let's have you for your brief statement. I was trying to put that at the last. You speak before we get the keynote speech, but my boss is impressing on me that he wants to hear your voice. So I don't know if you still want to maintain that at the last end or you want to. All right, thank you. Please clap.
Okay, thank you very much. So I didn't intend to speak because NCD is part of Ghana Health Service. So we're going to have a program and also another speaker. But let me say that listening through the meeting, I get the sense of a drive, and it means that we are trying to reach a stage. I remember some years back, we realized that the NCD space has been for some small group. But you listen to what we are going to ask the world. It's about an all government approach and all sector approach. NCD is not a health issue, it's multi-sectorial. So, in trying to address the issues about finance, it's about economics, it's about health, it's about agriculture, results will come. And then you bring the farmers, you bring the private sector. So I think that we try to agree on the next steps. It's about we all here and those outside, especially the media, to see ourselves as together. I normally say that it's not we and them, it's we. There's only one space, only one country, one world. And we need to look at address the issues as they directly affect us. So I want to say that as a service, we are fully much committed to see how best NCD can be elevated. I normally tell the NCD guys that I don't like it when partners say go here, go there. We need to be sure where we are going as a country. And then the partners will follow us. So that is our drive. We are moving and the partners will help us achieve what we want to achieve. Thank you very much.
Thank you very much, Dr. Becky. That is a very powerful one. No matter who you are, you may have the best of resources, but when you work in silos, you can go far. The aspect of the political will, yeah, that is what a lot of people feel. They feel that you are sponsoring a political party. No, you should be able to find a way to infiltrate, bring everybody along to support the cause. All right, thank you very much once again. Okay, so we have the Ghana Medical Association rep here. Okay. Community Health Access Initiative. All right. Do we have farm access here? Oh, okay. All right. Thank you.
All right, good afternoon, distinguished colleagues, partners, and stakeholders. My name is Clifford Kofi, and on behalf of the Clinton Health Access Initiative, I wish to commend the Ministry of Health and the Ghana NCD Alliance for convening this important dialogue following the fourth UN high-level meeting on NCDs and mental health. The declaration adopted in New York provides a renewed global mandate, one that calls for stronger leadership, sustainable financing, and integrated service delivery to address the NCDs and promote mental well-being. It underscores the urgency of translating commitments into concrete actions, particularly in a low and middle income country like Ghana. China is proud to be working alongside the ministry and other partners to advance this agenda in country. Our collaboration spans multiple fronts. We have helped improve access to essential NCD commodities and cancer medicines through coordinated procurement. We have helped strengthen and still do help strengthen data systems. We are helping expand decentralized care for hypertension and diabetes, especially at the subdistrict level. And we are also supporting early detection and treatment of childhood cancers and type 1 diabetes. We believe Ghana is well positioned to operationalize these global commitments that have been adopted, and this will be done through evidence-based planning, health financing reforms, and multi-sectoral collaboration. CHAD remains committed to providing technical and strategic support to ensure that these efforts lead to measurable improvements in prevention, treatment, and mental health outcomes, and good mental health outcomes for all Ghanaians. Together, we can build a stronger, more equitable health system that leaves no one behind. Thank you.
Together we can build a strong and healthy, equitable health system that leaves no one behind. And there is one thing about the private sector. Those of you who normally get our invitation letters, when you read it, check. We don't write private sector, we write relevant private sector because we know some of them are for the interest of the harm industry. So we are very particular about wording. So we invite relevant private sectors. So let's have pharmacists, one of the relevant private sectors. All right, thank you. Pharmacists. Whenever I recall an institution, the next I expect to hear or see they are clapping. Yes, let's encourage them. They are very important. Thank you.
Good afternoon, distinguished partners. My name is Kofi. I work with Farm Access as a project manager. A lot has been said about the topic today, so I'm going to keep my statement brief. On behalf of my organization, Farm Access, I wish to express our solidarity with all stakeholders gathered here to align the political declaration on NCDs and mental health with government's national priorities and institutional goals. This conversation is timely as non-communicable diseases and mental health conditions continue to weigh heavily on our nation's health system and economy. They are not abstract global issues. They are real challenges affecting families, livelihoods, and communities across Ghana. The fourth UN high-level meeting reviewed the world's commitment to act, and today's dialogue should ensure that these commitments take root in our own systems, policies, and practices. Achieving this alignment requires more than commitment. It calls for collaboration, innovation, and the use of local evidence to guide action. We must bridge global ambition with practical national implementation, ensuring that our institutions are empowered and our systems equipped to deliver people-centered care. It is with this spirit that Pharmacists, together with the National Health Insurance Authority and CHA, is advancing models of value-based care that harnesses digital technology, data analytics, and performance-based financing to improve outcomes for people living with hypertension and diabetes. These initiatives show how collective action can strengthen local systems, promote accountability, and empower patients to take charge of their health. As we move forward, we must deepen collaboration across government, development partners, academia, civil society, and the private sector, and the relevant private sector. No single institution can do it alone. Our collective strength lies in coordination, sharing data, learning from results, and aligning our efforts to improve lives. Pharmacia stands ready to work alongside all partners to strengthen digital health systems, expand access to quality NCD and mental health care, and support financing models that reward outcomes. Together, we can transform today's commitments into lasting impact for our people. Thank you very much.
Thank you very much. All right, so the last one before, that is what I have on paper here, before we take a keynote speech. The last time I heard her present in one of our programs, a lot of people were crying or shedding tears. People were emotional. I don't know whether the secretary is going to happen, but she is an advocate who has traveled across the globe, very passionate about her work. She speaks on endometriosis, and she's a person living with that condition, or the person living with NCD. She's also a member of the NCD Alliance Ghana. Let's welcome Catherine there to share with us. Yeah, solidarity is a key direction. Thank you.
Hello, thank you for having me today. My name is Catherine Berko, a lived experience advocate for endometriosis. All protocols observed. My journey, I just want to do a brief explanation on my experience with mental health. It happened because I suffer this condition called endometriosis. It's a chronic disease. I've had 8 surgeries. I'm still struggling. I mean, when I started doing the advocacy talking about it, everybody said, why are you talking about this topic? It's a taboo topic. And I wonder how it's a taboo topic. Because somebody needs to talk about it. Awareness needs to be made. But for my journey, it started when I was 14. I just briefly want to go to how it got to when I was suicidal. What got me to that point? So this is a 14-year-old, always in pain. My mom started going around doctors trying to get a diagnosis. And every time I see a doctor, I was treated like what I'm describing does not exist. And that was the first instance where it might take somebody to be in a dark space, because I'm feeling like I'm passing out sometimes. And I'm taken to A&E, and still they treat me like what I'm describing is not real. At a point, I was called timid. I didn't want to go to school. A whole lot. And it started affecting me. At a point, I didn't have any self-esteem. I had to build it up again, because sometimes I go to programs and I'm running back, I'm hiding, because that is how I was treated all along. And that is how it started building up. 11 years of being misdiagnosed. Finally, I got diagnosed. I didn't have somebody to even manage the condition. And a lot of women are fighting, are struggling with this silently. My point is, if I don't speak about it, more people are going to get in, I'll say the dark space. I call it the endo monster. I call it the gaslighting of medical personnel, because they never listen to me. I had to travel out before I was diagnosed. And at that time, it had damaged my reproductive organs. Long story short, how many years down the line? I've actually lived with pain for 34 years. And then from the time it's been diagnosed, I've been living with it for 25 years. I have better ways of managing it, but it really affected my mental health. I mean, you know you are dying, dying, I mean, in quotes, but you go to the medical personnel, they are telling you there's nothing wrong with you. It's the worst place you can be. For me, it was 89, 90. I can't go to the internet and check what they are, like what I'm feeling, and even have an idea of what it is. So mental health, I take it very personally, because for me at that time when I was suicidal, everything around me showed that it was the best decision for me, because I couldn't live in pain anymore. I'm having a morphine injection. The next hour or two, it wears off, and then the cycle begins over and over again. It's affecting your school, your work, your relationships. At the moment, I wish I had kids, but it didn't happen for me. So the least I can do is also educate people for them not to be in that space that I am now. So if I'm going to be able to educate another one person, then I'm not going to stop. I had a lot of things listed, but when I start, it's like I can't stop. But my point and my emphasis on mental health is mental health can come through loss of a loved one, trauma, but for chronic disease that I have experienced, I would say it's the worst anybody can go through. And apart from dealing with that pain, you are also dealing with the stress of finances, because it's not easy to have, even to diagnose it through laparoscopy, which is a minor surgery, and it's very expensive. The medication is expensive. Aside that, the medication that they're giving to help you with the pain has a lot of side effects. Now I have arthritis because my bones have become weak. But at that time, I mean, I'm not going to say I would never have had the injection, because it gave me some quality of life. Because the Lupron and the Zoladex that I was given really helped me have some sort of quality of life. So my point, I'm not going to go over and over again. My point here now is that one mentioned about exercise. For me, what has really helped me to date is walking, and it started in 2020 around the pandemic. It has really helped me. When I start walking, all these arthritis, joint pains, and everything that I have, it goes down. I don't have to take strong medication for it. The moment I stop, then I start feeling the pain. So my last note to say is never stop exercising. There's nothing like too much or little exercise. The little you can do it in your little space. I used to go for walks in my area, but I was chased by a madman, and he prevented me from doing it for months, and I was suffering. So I decided to do it in my compound, and it's really helping. So to end it all, I'll say keep exercising. Thank you very much.
Thank you very much. Catherine, well, I want to add that she's 50 years. You're taking the words out of my mouth. I wanted to say that, yes, when she turned 50 some few months ago, yeah, 50 looking young. Yeah. I wanted to check, when she mentioned about the madman experience, I was born and raised in Lima. And anybody in Lima show you are a thug. Whether you want to be or not, you still be a thug because of the environment, the things you see. One day I was going to jogging around Sunny FM, and then the madman was chasing me with stone. Charlie, Lima boy, Charlie, that is the Lima spirit in me vanish. I have to tell him, run back. If a madman hits you, who are you going to talk to or report to? The police station that, oh, sir, a madman beats me. They will laugh at me. Yes. But then, Catherine, that is a powerful testimony. Dog.
I don't know what we are referring to, who we are referring to as a madman. Who is a madman?
Okay. So literally in my local dialect, actually, Kai Hauka, it's like someone who is virtually naked, doesn't feel, virtually naked and looks bad and can do what normal people don't do. Yeah.
So when we see girls with skimpy dresses in the night here, they are mad.
They smile and no tears.
I'm telling you, why would we denigrate people? What do we refer to as a mad person?
Say you don't know for now.
No, but they both have used the word. Yes. That they have some meaning of who they refer to as mad person.
Sure.
But I don't. That is why I really want edification on who we call a mad person.
So probably it's a nice, interjection. If you could share briefly, there has to be a way to refine because we have all grown to accept that we have mad people, on the street.
Which ones do you refer to as mad?
Yeah, so that's why
When you
here.
say dressing, I can show you women who dress almost naked, but they are not mad.
So no, enlighten us so that we can learn moving forward and be careful not to use that word again.
Okay, so we are here talking about NCDs, some it mentioned endometriosis, which means that it's a taboo and all that. As soon as we refer to somebody as a mad person, you virtually are saying the person does not need care. Because you can refer to that person as an ill person. You probably wouldn't run away, but rather seek help for that person. You will see them as people who are ill, but they are mentally ill. Doesn't mean they are mad. And I'm not too sure what we mean by it, because if we want to say is mad mean somebody who has a mental illness, is that a meaning? Like I'm stammering, it's a childhood mental disorder. So basically I'm mad. Why not? If you say mental illness is mad, then probably any of us who stammer, anybody who's afraid of cockroaches or fear, anxiety, heights, they are mad. So what do we mean? Do we mean people who are ill? And are we having to denigrate some people who do no fault of theirs are ill with a tag so that we can attack them? Yeah, because that is what we are doing. We have tagged them some conditions so we can attack them. So you are bold to say, I'm running away from a madman. I'm not too sure if you can say I run away from a stroke person.
Thank you, Doc, for the enlightenment. I'm sure it's an application for all of us. I want to believe all of us have probably used that word before. But probably going forward, we also have to learn and show. They are people who are ill. That's the word. Okay, once we see them as people who are ill or have a certain challenge, our attitude towards them will have to change. All right, thank you. So, wow.
Next time, don't run away.
We need help.
No, safety first. Safety first. But I will not use the word again, but safety first. Yeah, safety first. All right, so we're going to a very critical point in our meeting this morning, where we want to have the keynote statement. And before I introduce our keynote speaker, share a brief about his background. Dr. Hafiz Adam is a public health specialist and is the current director for the technical coordination of the Ministry of Health. He is also the chairman of the Intra-Country Coordination Committee for neglected tropical diseases in Ghana. He also chairs several technical working groups related to non-communicable diseases. Before becoming the director of the technical coordination, he served as the chief program officer for the ministry's external health corporation. Before that, he has served as the national coordinator for the laryngeal project for malaria and other vector-borne disease control. He is a board member of the Pharmacy Council as well as a board member for the Kumasi Center for Collaborative Research on the KNAS. He has been part of several high-profile delegations, locally and internationally. He speaks several international languages, including English, Spanish, French, and Arabic, in addition to local languages. He's a big man. Before I ask him to take the podium to share the keynote speech, I have been in Amanewe, but I grew up in Lima. I go for meetings, I go to big places, and I sit with people who speak Ewe language, and they insult me. I pretend as if I don't understand the language. I speak a different language, but when I'm leaving, I greet them in the Ewe language. And I tell them, thank you. They say, oh. And then there's a girl who speaks the Ewe language, you bro. So, you bro. And I said, it's nothing. We are all in this together. So, Dr. Hafiz Adams, let's have you now to give us the keynote speech. Thank you. I'd like to invite you. Thank you so much.
Thank you very much. So before I deliver the speech on behalf of the Honorable Minister, I would want to associate myself with what the MC said about Lagran. Lagran indeed is a personality that approaches his work diligently and always committed. I think I've had the opportunity to work with him on SFE, issues of alcohol, and today we are here talking about NCDs. Laurent, keep it up. Let's acknowledge that. So the director for public health, my good friend, Dr. Asir Bekri, acting CEO of Mental Authority, distinguished representatives and members of NCD Alliance, representatives from WHO, development partners, healthcare champions, our warriors living with NCDs and mental health conditions, distinguished ladies and gentlemen, good afternoon. So, Minister is greeting you. I had the opportunity last week to represent Minister at the West African Postgraduate College of Medical Laboratories in Canada. And so the MC started talking, so, oh, we have never been lucky. Every time we are meeting, hopefully, we wish that we see the face of the minister. And so my answer was that, well, don't be disappointed. The speech is for minister, but the body is mine. So this note, distinguished ladies and gentlemen, I'm happy to represent my honorable minister, Honorable Governor Mutakan, who is the MP for your district. This afternoon, just weeks after the fourth United Nations high-level meeting on non-communicable diseases and mental health, I am proud of the collaborative efforts that carried Ghana through this global forum, and I think that NCD Alliance Ghana for the collaboration and national high-level meeting on NCDs and mental health prior to Ghana's participation in the fourth UN General Assembly. We appreciate it even more for this vital stakeholder engagement to propel us forward beyond the UN General Assembly. Distinguished ladies and gentlemen, the fourth-level meeting was a reckoning affirmation that NCDs and mental health are peripheral crises, but existential threats to our development in Ghana. Where NCDs account for about 45% of all deaths in Ghana, indeed, NCDs account for the mortalities referred to adults. So you can imagine the importance of NCDs. So the political declaration adopted in New York is a beacon of hope. It commits the world to agents, equitable action, from doubling investment in prevention to embedding mental health in every health system. Ghana's delegation interventions ensure that the voices of African nations, and indeed our own, echoed through the walls of the UN. We underscore that the fight against NCDs and mental health challenges can no longer be treated as a silent crisis, but must be recognized as a present and deadly reality. Distinguished ladies and gentlemen, the delegation was led by no mean a person but the Minister of Health, who emphasized the importance of integration, NCD and mental health services into primary healthcare system, and addressing the broader determination of health to ensure equitable, effective response. Central to Ghana's call was the urgent need to break financial barriers that push individuals and households into poverty as a result of NCDs and mental health care. Distinguished ladies and gentlemen, Ghana also highlighted the need for the meaningful involvement of people with lived experience, especially young people, as key contributors to shaping better policies and fostering public trust. The delegation further called for sustainable financing mechanism and encouraged action to address the commercial determination of health. Ghana conducted with a strong appeal that the fourth high-level meeting serves as a call to collective, conscious, and accountability. The declaration commitment are minor to our national aspiration. This reinforces our drive towards universal healthcare, where no Ghanaian is left behind. Emerging from this meeting, Ghana pledges to lead regionally by 2030, scaling up NCD screening and giving priority to mental health funding services under the NHIS. I'm sure the CEO should be happy. To achieve this, distinguished ladies and gentlemen, I call on all partners in this room to rise to the occasion. We must collectively design and adopt a national roadmap for action on NCDs and mental health. A blueprint that will guide Ghana's implementation and commitment made at the United Nations high-level meeting. This roadmap should outline clear priorities, measurable targets, financing strategies, and timelines. The integration of NCDs and mental health services into primary health care addresses the social and commercial determinants of health, and ensuring meaningful engagement of people with lived experience. And young people in all decision making are all on board. As I conclude, distinguished ladies and gentlemen, together let us align our efforts, pool our resources, and demonstrate that Ghana is not only committed in words, but in action. By doing so, we will transform the political declaration from promise to tangible resource. On this note, I thank you very much for your attention, and may God bless us all. Now, having read what Laurent presented, there are a few things I noted, and I think I have to comment on that before I take my seat. Number one, I think that we need to correct that it's not Muhammad K, it's Muhammad Kes. So there's S at the end. There's a difference between Muhammad K and Muhammad Kes. There's a difference between Muhammad Kes and Obama K. Obama K is a program. Muhammad Kes is an intervention born out of his compassion. And so that's why we got the S. So it's Muhammad Kes. And so the day that we're launching, we emphasize that it's not Muhammad K. Muhammad Kes. That's number one. Now, added to what you alluded to as a fight that the ministry should be expecting from industries. Yes, indeed, we have started experiencing that. I think on Monday or so, I was called by the chief director to a meeting I didn't know about. And when I got there, he was in the midst of API and other collaborators. I'm sure you know API. Yes. They were representatives of Coca-Cola. They were representatives from Brewery, and other manufacturers in the area or in the space of sugar sweetened beverages. And what was their objective? They thought they'd been neglected and they feel not being part of policies that we are crafting towards the regulation and making sure that they do not, saturate sugar in the beverages that they are preparing. And so we felt that that was a welcome move. And so what I did was to ask them to go and prepare an MOU. But in the conversation, I told them, yes, we are really doing that. And the issue has to do with the fact that the disease burden attributable to NCDs are traceable to their products. And we are not saying that it's only their product, we are even saying that physical activities, public health education, that will educate people as how to, because if you are not doing physical work, why would you load carbohydrates and go and sit in the office of air conditioning? You come out, you go to your car, it's air conditioning, you are not using the LED, and then in the night you load another one. These are all conditions that we are talking about. So it's not just targeted to the SSD. But they were not comfortable with that. They still insisted. So I told them that as part of what we are doing, we are saying that be innovative. Once you become innovative and you reduce it to use alternatives, then we will also be in a condition to support you to enjoy some tax waivers. That's why we're happy. But we are all aware that yes, it has its good part and bad part. No, but we can't say that we should close down, industry that are into this product because people will lose their jobs. And so that is the focus. We are mindful about that. Now we are also saying that, as you have said, the NHI is supporting in many ways. And I'm sure you are aware that by next year we'll be rolling out free primary health care. And guess what? We are doing that cognizant of the fact that part of the funds coming from NHI will go to deal with three key things. One, we are still looking about the infrastructure. We are looking at our team, and we are also looking at capacity building. And so, yes, we capture it, but don't be doubtful about the success of that program, because we are really prepared and we know what we are doing. Then, the last thing I want to add on is that we admire your support and the collaboration. And I want to assure you that the Ministry of Health is doing a lot of things to make sure that we work to fight against NCDs and mental conditions. Now, one of the things we are doing that for the first time in the history of Ghana, in November on the 20th, we are working to hold the first national conference on NCDs and cancers conference in Ghana. Only yesterday, I chaired the steering committee to make sure that we confirm the venue, we confirm the team, and we also get the rest of the people to talk. And so everybody will be involved. Academia will be involved. You, what do you describe? The stakeholders, social stakeholders, relevant, so you'll be part of it. And so on this, let me once again thank you for your attention and keep the good work and the God bless us all. Thank you.
Thank you very much, Dr. Adam Safit. That's a very good one. All right, so if you check through your program, we're going to the plenary where we want to give you the opportunity now to also share. And those of you who received the original letters we sent to your various organizations, one of the expectations of this event is to have a roadmap. You know, it's not just about coming to talk and then leave, but there has to be a roadmap to guide us. So that the year like this, and when we meet God within again, we should be able to track our progress as a nation. And so I would at this moment invite my boss, Gabriel Musa, to take over to elicit some of these points we are looking for. After this session, we'll take a good picture.
Right, so thank you very much. So on this note, in fact, you've heard previous speakers who have spoken at length on their commitment and everything. Now we actually wanted to follow a roadmap here, but to look at the time, I would give the advice of the Ministry of Health that let's want to solicit feedback on how we get this done, and then we will together with the Ministry of Health and try to develop a roadmap on we look at thematic areas and also go to the formal Ministry of Health normally would use for the roadmap. Purposely for the local duration, how we can, implement it and how we also track, its implementation. So, but on this note, the floor is open. I was told who actually wanted to make some interventions. So the time is now. If you have any question, but more specifically, want to look at the roadmap. What do you want to see the roadmap? How do we get this done? So that we don't wait till probably the next 5 years before we commit to look at what have we achieved. They want to have a regular, discussions. I'm told that there's somebody from the Ghana, the traditional about yes. So if you can give the first bites, then I'm also that I want to make an intervention. So that means we can now go to the others. So, Madam, if you can hear you, make your name and then where we're coming from.
My name is Dr. Sandra Sean. I'm the president of the Ghana Association for Medical Herbalists. We represent the herbal physicians at the various Ghana Health Service facilities and also at the various research institutions. And I think with the issue of NCDs, according to the World Health Organization, and even the statistics in Ghana, we still have 5 and more Ghanaians who consume herbal medicines or they going for traditional alternative medicine. So I want to plead that when it comes to politics or when it comes to decisions being made concerning how to manage NCDs, we should also look at that is the people who consume herbal medicines or even the practice of herbal medicines, the practitioners who are attending to Ghanaians, and even the products, that is the herbal medicines that are being used regarding NCDs. I believe it will go a long way also to help bridge that gap and solve most of the problems. Because we have so many Ghanaians, especially even those at the rural areas and all that, who only rely on herbal medicine for their conditions. Thank you.
Right, so thank you very much. Yes, I know you know that I do. I mean, that's of the fact that there are, some efforts around ensuring that, our locally approved, right, traditional medicines are embedded within our health facility. I mean, even the pharmacy even has those that are approved. I would really believe that the Minister of Health is here to probably just highlight on how we are going to integrate, our own traditional local medicine in our health facility, just so we don't leave them behind. So if the Minister of Health can give advice on that, that would help because, and thank you very much. And we apologize because from morning to date, we are not looking at our traditional medicine, how that is either impacting or positively on our health system and the people, in general. And I think that's an area I want to continue to discuss, right? What you, and so now those GIS, if you have maybe some comments that you want to pass.
Thank you very much, for the opportunity. So my name is Julius Ediam, and I'm the project manager for the Higher Integrated Healthcare Initiative, representing GIZ Ghana. So what I can say is GIZ Ghana has been a strategic partner for the Ministry of Health and the Ghana Health Service for many years. And we are working in various topics. With regards to the meeting for today, talking about the NCD space, we were invited by the Ministry of Health some years ago. I think that was in 2021 or 2022 to be a strategic partner for the implementation of the NCD strategy and policy. So with this invitation, we set out to work coming from the international services wing from GIZ. We are able to approach private sector, we are able to approach many public partners and source for funds to support the Ghana. So this is what we have been doing so far. And we are currently implementing the higher project, which is looking at health system strengthening for communicable diseases. We are working on things like revising the national guidelines for the management of cardiovascular diseases. We are looking at screening and treatment programs in the community. We are looking at patient empowerment programs. Dr. Hafiz has just spoken about the meeting which is going to be held on the 20th, which is a national forum for NCD research, which we are providing support. So if you look at all the interventions that the Ministry of Health has put together with regards to being able to achieve the commitments, you will see that there are many development partners working in this space that are supporting to contribute to the achievement of all the objectives. And today my request would be that the Ministry of Health should put some more efforts into how they harness the interventions that are being implemented by various public partners. We are part of the steering committee, so we have a multi-sectoral steering committee for the implementation of the NCD policy. We are part of it. We know that there are many stakeholders as such. And talking through all these various projects that are being implemented and making sure that we are plugging all the holes and being able to reach the objectives would be a strategy that we would propose that the ministry could do. Because if we are not in very good communication, there may be some work being done by some development partners or some implementing partners which is not captured by the ministry, and the ministry may not be aware. So it should be very high priority for the ministry to invite everybody and make sure that all this information is well captured for their own benefits to be able to reach their commitments. So with this, let me hand over the mic and say thank you very much to Abraham for being able to make us go together.
Thank you very much. Juliet, I think I appreciate that. So I'll give the mic permission for to just place out the traditional medicine. And then I won't take any personal one, but since Barbara is here, we also do amazing work. Maybe you can share with us briefly what there's what you want to see Ghana do going forward. So after that.
Okay, thank you very much, Sam. I'll answer them. Now, one, the reason why we don't have anything about traditional medicine, this is a specific area that we are doing, that is post for higher meeting on NCDs mental health at the UN. So we are looking at after the meeting, what next, what we do to be able to achieve the goals that we set. And so we are looking at the roadmap and the commitment. So the general discussion that we are looking at the whole range of things. So if you don't get it, because the specific topic we are dealing with have nothing to do with traditional medicine. And the second part of it is that the recognition of traditional medicine that is not enough. In fact, from 2019, we had carved out the directives, the full directive of this called traditional and alternative medicine directives, headed by a colleague of mine, Dr. Anastasia. So she is the head of that. And what we are doing, again, is that we recognize all of the rules that are gone through the system and the education services. We are all aware that, data shows that about 80% of Ghanaians, one way or the other, they fall on the traditional knowledge, particularly in our work. Some of them feel trust is more than the other. It is in as I said, we are making the efforts to make sure that we get the message. We have not signed the other health professionals that are still using to be able to get one person. The primary health we want it to be, and that's why we are able to license the chief component services. One of the body that we can't go in is when you don't have the structures. One we have not reviewed the services, and so this is where we are. So be rest assured that when it comes to policy, we have a representation because we have a director there, and she feeds on the way you people have to make your grievances pass through her since she's there. And you are aware again that annually is a conference that you people where the ministry that represent able. So once again, I'm just assured you that you are not elected. You are not part of the elected professions. You are able to thank you.
Very much. Like I told you, I want to leave that you are aware of some of these issues. So definitely we know where to and we will see how we can involve you more in our programs. So also to this professor. So we also want to just very brief. Then
thank you. I hope I will be brief. And I speak on behalf of my colleagues. So you talked about road mapping, so I'll make a few points. The first thing I'd like to say is that HAB has been very active when it comes to non-communicable diseases. Probably one of the first organizations to raise this issue in the country and bring it out of, recognition. The mic has an NCD. We have what we call the NCD Navigator. It is a tool that helps us to know which NCD is being tackled where in this country. So we need partners to log onto the mapping data. We have done it as a project and passed it on to the NCD program at Ghana Health Service. And I hope it's still being used because it's very sad when an NGO starts something and then pass it on to government and it ends there. But this is meant to see so that we know who's doing what where and where the gaps are so that we can fill them. That's number one. Number two, we have a very active program now on chronic kidney disease, which we are implementing currently in Ashanti and Greater regions. And what we're finding, we will soon have a conference on that, so I'm sure most of us will be invited to know what's going on with regards to kidney disease. It's not a pretty sight at all in this country. In fact, I would say I lost a child to kidney failure at the age of 13, so I have that experience myself. Then the third one, we've talked about taxation of tobacco and sugar-sweet beverages. The question I have is, do those taxes go into a special fund or do they go into a consolidated fund? Because if you get into that consolidated fund, you won't get that money to use NCDs. So that is one thing I would like us to plan. Where does that tax money go? And will we get it to use for NCD? That's number 3. Number 4. What have I written? Yeah. Okay, so we've talked a lot about HAI and everything else and resistance. Resistance will come definitely. So what I can say is, as part of our roadmap, let's do 2 things: education and dialogue. Education and dialogue. I myself find it very important that I walk up to a company that produces sugar with sweet beverages and say, can we develop a new version or a new product that is low in sugar, not aspartame, but low in sugar, natural sugar, that people can use which will help them. It's a kind of, and it's a challenge. We're not giving you an industry, we're not used to this. So for us, for me, my opinion is, let's do education and dialogue. And my brother and I have talked about this, and that's why when we talk about alcohol, he looks at me. I like to drink my wine. And you won't stop me from drinking my wine. So even if you make it a little more expensive, I probably won't drink what will kill me or what will sustain me. Even cough mixture contains alcohol. And anything I believe that anything that God created is good. It is how we use it that makes it wrong. So education, we shouldn't stop that. The last point I will make has to do with mental health. And I would say that we say NCDs and mental health, that is good. But I think in the long term, we need mental health to stand on its own. Because mental health encompasses so many things that when we fit it into NCDs, it gets drowned. So I would really advocate that in time, let's look at all the funding partners. Let's begin to look at mental health. And I like what Doctor said that we have children who have mental health diseases. They are not spiritual. They are things that can be cured. But every time you see somebody maybe saying things that you can't understand, the first thing you think is the person is possessed. So that is why I believe we need to look at mental health. I spoke with Reverend on the week. Sometimes we need to look at it as a medical condition. Let the doctor do his part. Let the spiritualist do his part. Together we can solve the problem. Thank you.
Right, so thank you very much. That's wonderful. Right, so she asked the question about, yes, so indeed the taxes go into a consolidated fund. That's where it goes to. But the point, I mean, so the point for us is the country have done it, it goes there, but there's always a goal of reading this. So I know that there are guidelines like so EMI. It goes to EMI certain funds. It still goes in there. I don't know how insurance, I don't know whether it's a few that's the 2% or the 2.5% of the where it goes. I don't know all the mechanism of ensuring that you get that. Right, so, yes.
Yes, it's true what you are saying. I agree with you, and that's not exactly what we are doing. And I alluded to the fact that because of the opportunity of giving employment to other circumstances that we should provide. The biggest thing we have and the biggest challenge we have today, if you are telling an industry that is into the production of vessels, what level of production are you talking about? Because nationally, we have no profile and we don't have the specific grams of sugar that you put in a liter of water. And so that's the challenge. So we are working on that. When we establish that, look, this is the level that you have, the means that any other person beyond that, we either charge you or we stop you from that production. Again, when they came as I was saying, yes, we are making a profit, but you should also agree with me that at the end of the day, people die of the sea. You have no customer to buy. And so what we should be doing rather to support us, do research, but diverting your how social corporate social responsibility funds, so that together we can go into research, then we'll be able to support you scientifically, your alternative, while we also make sure that it does not cause or run up onto the disease burden. And so I agree with you, but not until nationally we profile and we are able to see that this amount you can't go beyond that. Until then, we'll still be having this challenge by saying that others control this. But if you have the specific ground that you should put, then you hold them to that. And that's why FDA is there. And that's our military, outfit when it comes to food and drugs. Thank you.
Right, so thank you very much. So on that note, I think we are almost done. I will just take the opportunity to just do a final. What's something for this? Right, so just a final review from us. So we have quite a number of activities and plans for for a year, maybe next year. And for me, just as Julian mentioned, there's a need for us to integrate our work. We're closely together, even as relevant partners, in the space. I am looking forward to next year, where we are convening another meeting of non-health actors. Yes, but that's what we are going to do. So if the partner here is willing to come on board, support and own, how will we the non-health actors? So we bring them, not in the school, where it shouldn't always be the health actors. Where are the non-health actors? How can we make them more contribute to this objective? That is very important. So that's the way we are working for this year. I don't think I'm going to GIS, farmers, GIS, Ghana. Also the partners who are here and we want to support that conference we are planning for next year. But otherwise, I also think that we also let our conference on this year cancer, which we are ready to support in that regard as well. So we are put any profile of NCDs and cancer in the country. And then we are next week we are having an event, a very big and powerful event on the Ghana Medical Trust Fund, the Mahama Cares. So the event seeks to ensure that the Mahama Cares will medicate. So definitely will make this mistake. And we are going to ensure that these Ghanaians understand what this whole Mahama Cares is about. Because trust me, I've had many calls. People call on me, yes, we put that on. How are we, they want to understand where are we at, how are we, because it's like nobody's aware of this. For some of us, we are really because at least we're parliament to before it comes us, we are doing the content. But I cannot speak for the sick person.
So we want to have that conversation where the Ministry of Health would articulate the content, what's inside, and who are the main beneficiaries. So that conference will be held somewhere next week, and hopefully, I'm sure many of you probably have gotten this already. And this is also being done in relation to the issue of health. And then UACB, I mean, has always been scheduled for 12/12 of every year, the 12th of December every year. Hopefully, we will be launching of the Ministry of Health, thus again, see how we can collaborate. Because that's the UACB. And so, want to look at how are we faring with respect to the roadmap that Ghana has developed, also with respect to the Ghana NCD policy strategy. So, I'll look at how we can continue to reduce the out-of-pocket payments, the catastrophic out-of-pocket payments that people live in NCDs. But people living with, this is entirely our focus is mainly on NCDs. Because if you look at the roadmap, and Amazon against so the fact that the number of coverage are not being given much priority in the Ghana's roadmap, I'm sure when we are reversing, we'll have more of that inside the Ghana's roadmap. So we will be looking at the doors once again, so we can collaborate this point on the UACJ, which is scheduled for December of 12th of December every year. Right? But more especially, look, I think that everyone expects when it comes to the issue of aggregation, and I really appreciate, your objectives and the advocacy you have used for us when you met AGI, the industry players. Indeed, we know that they always, and it's very difficult to have policymakers come out to say that these, and also be depends. Outside is a common game. Let's make up the say, you had an issue with them, so that ADAC. And that is it, because and I always say that there's a link between, the commercial industry, objective, and the use of power. We are a bit far apart. So we need to collaborate. There's sometimes some collaboration at the, it doesn't bring, not yet, rather, you see the problem. So we are happy, and we are happy about the comment that was shared with them. We are hoping that they will go and do their own way, and they're not disturb us when we want to prioritize public health. One of the ideas that we have been doing every time is that policy development should be just the nature of development. Once we are done, we can share with them. So we are down focus to look at it. Yes, we will always make recommendation, right? Some recommendation we make, it's not all the missions. So we do our feedback to you. Then we should decide where to take it or leave it. Because you are for the people, the help of the people. So yes, so I think that we will continue to appreciate the mission. I hope that they will go further up, further way. One day, I know that I'm not probably of the matter of every anything is very good. So they want the ministry, matter it doesn't work. I know they want to still go up. But irrespective of where they go, I know that we have people with good conscience. Go with, American public health, and help Ghanaians, that's of the industry. And then lastly, on the industry and then the reformulation. Yes, those policies will definitely be done. And let me just share that, no industry will be banned for producing its products. But we will consciously ensure that Ghanaians are aware of what is healthy. Because they produce the products, there will definitely be some warnings, maybe high in sugar, high in fat, high in saturated, whatever. So when you see it, now you are informed. And then the others that are healthy, I will not have those warnings. So that is the objective of, for the policy that we are all, support the Ministry of Health to fast track, its development, and then probably its implementation. On that note, I would say, let me say thank you to everyone for coming. And before I hand over the mic to our able moderator, to all whoever that is expected right now. Thank you so much for your attention.
of those years. You know, I've been in and out of the section because I'm not feeling quite sure, but I think it's a very early issue that I want to just share. Yes, so thank you for asking who am I. My name is Martha Kofi. I'm the Ghana Federation of Disability Organization, a person with lived experience in mental health. And please, I just want to ask you, as a CEO, before I come to you quickly, please, I want you to tell us the current state of the legislative instrument to the Mental Health Act. What's so far can be done? Because we persons deal with mental health conditions within the educational sector. Right now, since Ghana is running with inclusive education, and I understand we don't see many of our people. And I'm very pleased when you mentioned child mental health and what the mental health authority wants to run with. So I want you to brief me. And also the progress of the 4 mental health conditions that the previous administration committed to enrolling onto the NCDs. So you can help me with that. More also, I also want to find out about what levy has been assigned to feed the mental health fund so far. And also, last but not the least, you know, people have become so fatigued. So, I said, if your doors are open, right now, people don't want to read. People just want something that is lively. And I was very happy when my last one before I stepped out was making a submission on education and awareness. Do you think it's welcome for us to be more innovative to use the various social media, those ones that are very current, so that in a bit of educating, we try to create funny content with people who are very good in those areas to leverage past information, because I wanted again to hear that there is an issue of someone using the regulatory mark for persons living with a mental health condition. I think that's the way we can go if we really want to change the narrative. Thank you.
Thank you very much. I think there are 4 questions.
Sure.
So let me start with last. So when I took office, just I think 2.5 months ago, or 3 months ago, we've been doing mental health month, mental health day, press review, press conferences, and it's so interesting to bring this up, because I asked the people who help us organize. These are 4 young people, and I asked them, did you hear about the press conference? Oh, I got to the radio. I don't know it. It's okay. When you take these things, because we have a whole IT department, and I asked them, oh, where do you read them? So on Facebook of the authority. Do you have Facebook accounts? He said, one said yes, she doesn't go there. Because my kids tell me Facebook is for old people. He said it is for old people. Then I challenged them. You are young people. Mental illness affects the young people, not older people. So if you are doing press conference and those things, who are we targeting? I have the talk, so what do you do what you do for? You go and put it on Facebook and it's on Joy and City. Young people don't go there. So, and it's been a battle that I have now, because that's what we have been doing. That let's stop spending on press conference and press fees and go on TikTok, Instagram. And it's becoming like the guy is busy. This is how things are done. Yeah. So I'm yet to get to that level where I'll get a bag in there. We should rather spend on TikTok and Instagram than go on Facebook or go, because we organize and we have to pay the media. I saw Joy FM here. Lambra, I'm sure that you pay them, you give them some money. But the young people will not hear anything that's happening. They are saying here. Nothing. Don't hear it. They don't go there. Mental health affects young people. The young people are on social media. So I don't know if this thing will be on social media. Most times when we do something like on social media, we go for Facebook. And my kids laugh at me. They say they didn't have Facebook account, so that we didn't see. Yeah, so let's be innovative, let's get to the young people on the social media. And what's, like you said, we need less than 1 minute video to capture everything. That's what the young people want, not what we have been doing. These are long speeches and they don't hear us. So I beg you, if you can do the short videos, 40 seconds, 45 seconds, we capture everything on NCD. 45 seconds with a video with some slim breast woman on it. Oh, that will give you millions of views. If we do what we are doing and put these speeches there, nobody will read them. So I'm very happy you brought this up. So let's do that. I haven't been able to do that yet, but I hope to do that. But for me, if you want the young people, we need to go down on social media, not on social media. The LI has been passed. The act after the act. Unfortunately, we think both of them need review. My predecessor started the review. So I hope to continue and do the review of the Mental Health Act and the LI. Unfortunately, the law establishes the LI. But I understand with the experience of Get Fund, where a tax component is ring fence for one activity, government doesn't want that again. Because when they want to put some of the money for something else, it's like this alone. So we are finding it difficult to get and levy something that will feed the fund. So the fund has been established, but no money goes in. So that is how it is as of now. And like I said, I wish we could get syntax exciting on those products which give us problems, the sugar, the alcohol, the tobacco. I mean, those things that give us all the challenges. Social media, porn, betting, gambling, this gives us problems. Let's put tax on them and use it to take care of our mental health. So it's something that I am preaching, I've not been heard yet. So if you can also help me amplify that, I'll be very grateful. We need to fund mental health if we want it. The first one.
Yeah, so the last one for you to react on is the mental health tribunal.
Okay, yes.
And where we can access it.
Yes. So, and it is one of the things I want reviewed in the law, and probably as stakeholders, I would also happy if you agree with me or anybody would disagree. So, I want that tribunal be removed from the law. The law, the Mental Health Act, establishes a mental health tribunal which sees that if persons with mental illness or if anybody is treated with a mental disorder anywhere and you feel aggrieved that they are treating well, you apply to this tribunal and then you get redress from them. Supposed to have a lawyer, I think of 7 years experience to chair, a psychiatrist, a social worker, and lived experience on the tribunal. My question is, I mean, okay, this is also an mental health authority. So it has to be funded by an authority, which does not have money. So we virtually do not have money. The whole of last year, they had 2 sittings in 2 regions because they have to pay the people, and it's not there. And I think that is not an efficient way of spending the authorities' time involved. And I think that is also stigmatizing. I believe, which I want to propose and put in the law, that the tribunal shouldn't be a tribunal. We should rather have mental health people at track. Because track is for human rights. We are looking at the human right of persons with mental illness. Why not a special tribunal for them? So meaning that if you are mentally ill, you come here, but the rest of the people go here. I mean, why should we create a tribunal for mental health? It's part of human rights, so it should sit in charge. And trial is nationwide. Everybody goes to trial, seek justice. Mental health care, NCD, whatever you want. I think we should use trial instead of really having to create an additional court system in authority and pay them. I mean, I really don't think there is a way to go. I really think if not trial, then there should be dedicated courts for mental health cases, and should be in the courts where everybody will see human rights. We shouldn't be creating things for mental health. They're not different from any other country.
Thank you, Doc. Thank you so much. All right, so we will go to.
It's not 51, my question is about.
Which one?
Mental health.
Yes, so that was just a political talk. It's never happened. It's still not happening. We are still talking with National Health Insurance for psychosis, anxiety, depression, and bipolar. So, but the last time we had a meeting, there was a talk about telehealth, and I suggested it was accepted. I hope they did that. Mental health is one easy way we can implement telehealth, because mental health, I mean, necessarily have to put my finger on the example of the lab test. I just have to see how the person is behaving and talking, and I will get diagnosis. So it will be easy to implement telehealth in a health or in mental health. So NHIS should go that way, where we will have telehealth also, so that it can be built in NHI, and then they will take this forward. They are also raising concerns, not started that. They are reviewing all the tariffs. So they will take the form on board when the tariffs are reviewed. But as they've not done it, and I'm hoping they will. So hopefully they do the form and they will get the buy-in for the telehealth. I mean, it's one of the priority areas I think we can expand mental health to everyone, so that we can get somebody call and assign to maybe somebody in Bangkok and in Accra. I see you on the phone, we talk to you, and then we get that services by.
Thank you very much. The man from Joyce wants to qualify as an
Yeah, Doc, thank you very much. I'm Maxwell from Joy News, and then you raised the issue of us trying to read the younger ones, the 36. I think that's a good initiative. I want to clarify that Joy News on TikTok, we have 4,000 followers. On X, 1.4 million followers, and on Instagram, 340,000 followers. So we post on those websites as well. It's not just the traditional media. Thank you.
Thank you.
I'm not sure. I mean, the Gen Z don't follow John. John will be followed by us. No, that's the point I'm making. Okay, I teach in the university. So I ask my students who are Gen Zs, did you see me? Did you hear about this? And they say no. But the things are cool. They will be on Joy, they will insist. But they are not hearing them. And they're like, why do you go to be praying? Because I follow to be praying, I follow John, I follow this. And I think it is new generation who still follow them on X and stuff like that. So, and it's like, okay, it's like I follow CNN. You think my daughter, my son will also follow CNN?
Yeah, so there are people beyond 40 who still believe their disease. Yeah, so it's controversial. Okay, so let me, before I call for Francisca to give us the report of that, let me acknowledge the foreign media outlets, the Ghana News Agency, Dr. Luthi, Ms. Aluthi, thank you so much. Majesty FM, Young Party and FM is here. We have Joy News, Joy FM, and Matthew, Media Alliance for Control and Health. Thank you. So let's have Francisca to give us a vote of thanks, after which Reverend Daniel will give us the closing prayer, and we shall have a good program. Thank you.
So, on behalf of Ghana NCD Alliance and the Ministry of Health, I would like to express our profound gratitude to each and every participant, to the students, to the partners, and to everyone that shared their valuable insights. We thank you all for making it possible to come here, and we hope that our talk will not just be a talk, but it will be a walk. Thank you so much.
So let's have Reverend Daniel give an closing prayer, after which we'll have a group photograph. Thank you.
Thank you very much. It's been a very insightful moment. Please can we rise up on our feet as we say a word of prayer. It's closed. Can we please close our eyes? Our Lord and Master Jesus, Savior, Redeemer, our soul, hallelujah. Thank you for such a great moment. We started with you, we are ending with you. It's been a great moment, Lord, of knowledge, sharing, insight, ideas, thoughts. We are so grateful. We, Lord God, and every entity represented here to give us the ability, the strength to be able to carry out the mandate, to be able to do that which you have purposely called us to do. We pray that, Lord God, whatever will be an impediment in all these advocacies, we pray that, Lord God, you give us the know-how, the wisdom, the idea as to how to go about them. And we know that at the end of the day, we will be able to penetrate and affect lives positively. There will be a change in our environment. It will be a very good place for us to live. Therefore, unto him that is able to do exceedingly abundantly above all we can think and imagine, the Lord bless and keep us. Lord, cause his face shine upon us and be gracious unto us. Lord, cause his countenance be with us. And the Lord go with us now and forever. Amen. Thank you very much.
Please, if you can move forward, please, and let's have the group picture.